So I'm going to introduce Anna Marshall. She's a licensed social worker, clinical social worker here at Houston Methodist with a strong background in mental health and community psychiatry. She supports liver transplant patients through every stage of the transplant journey, providing counseling, case management, and advocacy. Her work focuses on addressing emotional and psychological needs while helping patients and families navigate complex medical support systems. Please give Anna a round of applause.
Hi, everyone. Good afternoon. Can everybody hear me okay? Thank you so much for being here. I'm surprised at how many people showed up, and thank you again to the organizers for including this topic in today's event. I think mental health is often a topic that's overlooked whenever we're thinking about the overall impact of illnesses, the course of illnesses, and the treatment of different illnesses. But mental health or a lack thereof really impacts every single aspect of our lives. It impacts our work performance, our relationships, and of course, it impacts our physical health too. We know that prolonged or chronic stress leads to an increased risk of things like stress and heart attack. We've known that for a long time. There's other obvious ways that our mental health directly impacts our physical health. Like, for example, whenever people experience intense anxiety, sometimes that sort of manifests in the body as nausea. Sometimes people have vomiting. That's probably not the best to talk about right now. Sorry about that. I won't go any further with that. But there's a lot of different ways that our mental health can directly impact our physical health. Some other more indirect ways that our mental health can impact our physical health is that it can create a barrier to engaging in the treatments that we need to address our physical health concerns. So a lot of times what I see working in transplant is whenever patients have a serious mental illness that is not appropriately treated or addressed, they have a really hard time keeping up with medications, getting to appointments, utilizing their support systems appropriately. All kinds of ways this can happen. Along the journey, sometimes whenever people experience medical traumas, they'll develop PTSD or PTSD, post-traumatic stress disorder, like symptoms that will prevent them from coming in for future treatments. Scan anxiety, a lot of times people will postpone or cancel their appointments because they have a lot of anxiety about maybe the scan results or going up to the hospital to get those scans and all of that stuff. So mental health impacts our physical health in so many different ways. Um, you guys are in a unique place because you're not just managing HCC and you're not just managing a liver disease, you're managing both of those things simultaneously. So you have your cancer and that treatment and that team, and then you're also managing the liver disease, that symptoms, and you have your liver doctors as well. And sometimes it seems like things might not be very well coordinated within those two teams. So it's a lot of phone calls, it's a lot of appointments. The 3-month monitoring interval can seem like you're at appointments all the time. I was talking to some colleagues the other day, and one of them was talking about all the appointments she has coming up, and she said, appointment fatigue is real, y'all. And I said, I wonder how our patients must feel with all of their appointments. The amount of appointments we have is nothing compared to this. And then some of the symptoms that come along with liver disease, like those memory and confusion kind of challenges, can make it really hard to engage in your treatment, keep up with all those appointments, your medications, nurture your relationships, manage work, focus at work, all of those things. And then we can't talk about liver cancer, liver disease without talking about the stigma that comes along with it. That can make it really hard too to connect with people and talk about what your needs are and what your experiences are, because there is this stigma that's kind of hovering over it. So when it comes to coping with whether it's a major illness or any kind of problems in life, there's a few things you need to know about coping. Coping doesn't mean that the problems go away. Coping doesn't mean that you don't feel any kind of uncomfortable or painful emotions. Coping is really about continuing or being able to function in life while those problems still exist, being able to feel those uncomfortable feelings and still function in your day-to-day life. You might find throughout life that as things have changed, your coping strategies and your approach to coping might have needed to change with different seasons and different problems that come along as well. So what worked for you in the past in regards to coping and in your past seasons and past problems might not be working so great right now. That's okay, that's normal. The good news is that you can always, at any stage or age of life, develop and learn new coping strategies. There's all kinds of coping out there. People do, from the time we're born, we're learning and developing coping skills, whether we're explicitly taught them or not. Most of us are not explicitly taught them. And coping skills are not always healthy or really effective coping skills. Alcohol use is a coping skill. It's not healthy, especially for somebody who has some problems with their liver, but a lot of people use alcohol as a means of coping. And sometimes for a small amount of people that works until it doesn't. But for the majority of people, it creates more problems in the long run, even if it seems like it's a short-term thing. So there's lots of different coping strategies. I'm going to go over really quickly some very basic ones, but just know that if what you're using right now doesn't seem to be working for you, there are always so many other things that you can learn and develop if you're open to new ideas and willing to practice them. Coping skills aren't developed overnight. You don't just practice them in one session and then you're an expert in using these coping skills. And it doesn't always happen in sort of this straight line sort of progression. Some days coping might be easier and look better than other days, and that's completely normal. So one of the most basic, simple coping skills anybody can use is deep breathing. And you can't talk about coping without talking about deep breathing. It seems really underrated, but there's so many benefits of it. I talked earlier about how prolonged chronic stress can lead to increased risk of heart attack and stroke. Whenever you use deep breathing, it actually it makes physical changes inside of the body. It reduces the cortisol level. Cortisol is a hormone that is released in response to stress. So if we're having a lot of stress, our cortisol levels are high. And it's really that cortisol mixed with a few other hormones and stuff that lead to the increased risk of stroke and heart attack. It's not the actual stress itself. But if anybody's ever told you, hey, just don't stress out about that, you know that's a lot easier said than done. But we all know how to breathe. We just have to tweak and pay attention to the way that we're doing. And so deep breathing actually brings down the cortisol levels in our bodies, which reduces the stress. So taking time out of your day, even if it's 3 to 5 minutes several times a day, can help in the long run to really reduce the overall amount of stress that you're experiencing. We're not going to bring that cortisol level or that stress level down to zero. That's not the goal. But reducing the amount that we're experiencing can have really great short-term and long-term effects. I'm not going to go into the rest of these. The 5, 4, 3, 2, 1 grounding exercise is really great if you're prone to panic attacks. It can really quickly bring somebody out of a panic attack or prevent them from going into a full-blown panic attack. There's a lot of information about that on the internet, and you can use that in different ways too. I don't know how well you can see the little words on this very colorful wheel here, but this is called a feelings wheel. And I use this all the time. And you would think as a therapist, I would be really good at naming my feelings. But whenever I'm feeling those feelings and they're like at a 10, it's really hard for me to really find those words to describe what I'm feeling. So I bring this up because a lot of times what people might be, we're really familiar with mad, glad, sad, those kind of feelings. So people are like, I'm feeling really sad. But if they take a deeper look, they might find that what they're feeling is grief, which is different than sadness. And I bring up grief specifically because a lot of people tend to associate grief with death, but we can grieve all kinds of different things. We can grieve past relationships. We can grieve past circumstances, past versions of ourselves. So I work with a lot of people who become very symptomatic and they're not able to do the things that they used to do to cope. They're not able to be as active as they used to be. They're not able to travel for different reasons, a lot of different things. So they're grieving a previous version of themselves or a previous lifestyle that they no longer have. And whenever you're able to accurately identify what it is that you're experiencing, it automatically takes power away from that feeling and gives it back to you. Because then you're able to process that and address that in a different way than if you were calling it sort of general sadness. I'm not going to go into this one too much for the sake of time, but this is really about challenging our unhelpful thoughts. If you're finding that you're having a lot of thoughts that are related to some uncomfortable feelings that you have that just aren't helpful, there's lots of different ways that we can challenge those thoughts. I'm not going to go into this one too much either. We know that things can get really overwhelming really quick. There's a lot of stuff on our plate that we have to manage. So focusing on one small task at a time can be helpful. What's really important about this slide that I want to talk about is this idea that we tend to think that we need to feel motivated in order to do something. And oftentimes that motivation isn't going to come, and then we just sit around waiting and we never actually take action. What you might find is that action oftentimes comes before motivation. So maybe you don't want to do the dishes, but you really like the feeling of having a clean kitchen. So you're going to do those dishes anyway, and then you feel the benefits of having those dishes done. So action, just doing it, and then once you do it and you feel the benefits of that, that motivation can come later. I'm not going to go into this one too much. We all know it's easier said than done, again, to focus on what you can control and not focus on what you can't control. My husband told me last night, he heard something that said, if you can control it, why are you stressed out about it? Because you can do something about it. And then if you can't control it, why are you stressed out about it? Because you can't control it, which again is easier said than done. But there are ways that you can work on that and do like visual activities and stuff to help let go of those things that you cannot control. Support systems, I don't think I have to tell you guys that support systems are huge whenever it comes to coping and managing day to day. There are specific things that I want you to know about support systems that you just might not have thought about before. A lot of my patients, especially my older patients, might say to me, you know, I have children, but they have their own lives and I don't want to burden them with any of this. And so I do an activity with them. And there's a lot of research out there that shows that helping other people helps us feel better. We like helping other people. There's a lot of motivational quotes that say, if you're feeling down, if you're feeling bad, go help someone because it's going to help you feel better. And so with my patients, I tell them, think about a time that you've helped someone, anyone. So they think about a time and I say, how did you feel whenever you helped them? 100% of the time, people will say, well, I felt good about that, or some version of that. I say, don't take that joy away from your family. Don't take that opportunity away from them. Let them help you. Let them be involved. That's really their choice. So let your support system help you. The other thing I want to talk about whenever it comes to a support system is I want you to think about using your support system strategically. Usually we have one person that we're closest to that things tend to fall heavily on. But I want you to think about the different people in your life and think about their strengths. What are they good at? What do they like doing? So for example, maybe you're one person, that main person in your life is maybe not a very good cook. Maybe they don't like to cook. Maybe that's a big sort of weight on them. But if you know somebody else in your family who does like to cook, who enjoys doing that, maybe they can get involved and prepare some meals for you and take some of that weight off of your primary caregiver and help get your needs met as well too. So there's a lot of different ways that you can look in your support system and use them strategically to help take the weight off of different people and spread that around. Caregivers, I have not forgotten about you. I don't know how much time I have. I'm sure I'm over. I have not forgotten about you. If you don't hear anything else today, hear me say that you and your stress matters too. What you're experiencing matters. I can't look at that because I'm going to cry. What you're experiencing matters just as much as what anybody else in this world is experiencing. And although it is the patient that received that diagnosis, you are having your own experience of that diagnosis and of that treatment and everything else that comes with it. Everything I've said about mental health and how it impacts your physical health and your relationships and coping, all of that applies to our caregivers just as much. So it's important that you take care of yourself, and it's important that you set boundaries as well with your family members. When to seek extra help. I always encourage people to start counseling as soon as they receive that diagnosis in the very beginning. That does a few things. A counselor is going to get to know you really well. They're going to know your baseline before things start to unravel. And you're going to be able to process things as you go, as they happen, and address them as they happen. Your counselor is going to be able to know whenever they see a shift in how you're presenting and say, hey, what's going on? Let's go ahead and address this. When things start to unravel, the deeper in a hole you are, the harder it is to climb out. As things start to unravel, it might be harder to start engaging in treatment or counseling rather, and make that part of your sort of routine. However, I will say that if you are having trouble functioning in your day-to-day life, if it's impacting your mental health, that is, if it's impacting your relationships, your ability to engage in treatment, if you're finding that you're feeling hopeless more often than not, and in transplant, I would require you to see a psychiatrist at that point to get some extra help and then follow their recommendations because it does impact your overall health and your ability to engage in treatment. And if we address the physical stuff without addressing this, it's not going to work long term. Lots of resources. I'm not going to stand up here and act like resources are easy to access all the time and they're at your fingertips. There's so many things out there. I think the only thing that we don't have resources for really is a support system. We can't give you a support system. It's something that you have to work on. But the one at the very bottom is what I want to point out. I found the Patient Advocate Foundation through the Blue Fairy website, and they offer case management services. They have a short video about who's eligible for case management, what they do, what they don't do. And I recommend as soon as you leave here, go find this video, sign up for case management if you haven't already, and if you're eligible, because having a case manager really takes a lot of the work out of finding different kinds of resources depending on what you need. Different kinds of apps to help you work through those breathing exercises if you're interested in that, if you need some help with pacing and such. I don't know what you're taking away from this, but what I hope you take away from this is that whatever your responses are, whatever you're feeling throughout this journey, whether it's something that I've said or that's on this slide, it is normal, it's okay. You can learn different ways to manage that and continue to function through this, and you do not have to do it alone. Even if you have a minimal support system, there's all kinds of resources and other people out there to help you. That's it.